Healthcare is an extremely controversial topic. Everyone has something to say about it in general, whether they're talking about their own country's healthcare system or the US one, which a lot of people love to comment about. In a recent video, I compared free things in the UK to things that would cost in the US, and the first point that I made was healthcare, which sparked about 99% of the comments in that video, all with their different opinions on either the UK or the US healthcare system, like literally hundreds of comments debating about healthcare and which system was better. And then I had one from an American who said she was thinking about moving to the UK but did want to know more about the healthcare system and just kind of asked for a video kind of breaking it all down for an American who's never experienced the UK system. So I figured it was a great topic to dive more in depth about, which brings us to today's video. So now let me just say I am an American who has lived in the UK for about 2 years now, a little bit over that. So I do have experience with both systems, and I'm going to go through all the different aspects of the two healthcare systems and just explain how they differ or how they're the same, and then kind of give my own opinions based on my experiences with those things. So the point of this video isn't to debate which system is necessarily better. That's for politicians and people who love to get heated in social media comments. There are pros and cons of both systems. I'm just going to go through all of the info today and let you kind of make up your own mind about it or which system you'd prefer, but I will give you my opinion about both systems at the end just based on my experiences, so do stick around for that. So let's dive in. First, let's start with registering with a doctor. In the UK, for the most part, you can see a doctor within a certain radius from your postcode, so you have to go to the NHS website and register online. So you enter a postcode or your location to look for your GPs in the area that you want to register with. Like I said, most people will need to register near where they live, but there are some GPs that do accept patients from further away. So you'll choose the GP you want to register with that offers online registration. You'll fill in the registration form, which takes about 15 minutes or so for each person that you want to register. Then you're usually confirmed within 5 days of the GP getting your details, but it may take longer. And when you register for a specific GP, you're registering for the office, not one specific doctor. So every time you do go visit that office or schedule an appointment, which I'll go more into in the next section, it's possible that you will see a different doctor every single time. So that's one thing I don't like about the system. If you move outside of the GP's practice coverage area, you will have to switch your GP most likely. In the US, it's pretty similar, except it's based on your insurance. So when you're registering with your insurance provider, you'll be able to browse all of the doctors that accept that specific insurance. Then you can select one. And the main difference is that it's not geographically specific based on where you live. You can go to any doctor you want, no matter what, as long as they accept your insurance. And when you register for a doctor, you're registering for that specific doctor, so you can see that doctor every single time, which I personally like because then I establish a relationship with that doctor and then they know everything about me and my history. Plus, if you like your doctor and you move or their office moves, you can keep seeing them. Now let's talk about appointments. In the UK, booking a doctor's appointment feels a bit like winning a radio contest. You call at 8 a.m., you press a million buttons before you even get to talk to a real person, and then you finally get through and congratulations, you got an appointment 3 weeks from now, and it's probably going to be with a nurse that only handles specific basic things that might not even be able to help you with the actual thing that you're calling about. So this even applies to referrals. When my daughter was first born, she got referred to a specialist to get something checked out, and it took about 5.5 months to get that appointment. In fact, it took so long that when we actually were at the appointment with the specialist said, oh, we actually can't really determine this anymore. She needed to be seen before she was 3 months old. And I was a bit frustrated because I had called a million times. I tried to hurry up the process and all they told me was, there's nothing you can do. The referral's been sent. You just have to wait. And, you know, that could have cost her something if it ended up becoming something more serious. And it's just because it took so long to get that referral and get that appointment, which is really frustrating. So the biggest pro for the UK system is that you won't pay anything out of your pocket for that standard appointment or even referred to for a specialist appointment. Like I talked about in the free things in the UK video, nothing is free. It's all paid for through your taxes, but you won't pay anything additional out of your pocket when you go to the appointments. Whereas in the US, you will typically always have to pay a copay when you go to your appointment on top of your monthly insurance payments. Of course, the exact amount is going to depend on what insurance you have, but I'd say a standard copay payment is somewhere between 20 and 40-ish US dollars per appointment. But the pro is that you can get a same day appointment, which is amazing. So in the UK, you wait forever but pay nothing aside from your taxes. services, and in the US you get in quick but you pay a lot. So it's really up to you to decide what's more important to you, your time or your money. Now let's talk prescriptions. In the UK, when your doctor prescribes you something, you take the piece of paper to any pharmacy you want, hand over your prescription, pay about £9, and then you're done. If you're Scottish, Welsh, or in Northern Ireland, even better, it's free. So if you're in England and you are over a certain age, under a certain age, pregnant, or have some serious medical conditions where you constantly need medication, you can also get a medical certificate to make your prescriptions free as well. In the US, you have to pick a pharmacy. When you're at your doctor's appointment, they will send over the prescription directly to them. Then you head over there, you pick it up, and when you get there, you typically will have to show your insurance card before picking up the prescription, because the doctor does not submit your insurance when they are submitting for that prescription. So the pharmacy uses the information on your card, like the member ID and policy number, to verify your benefits and bill your insurance company for the cost of the medication, which also shows them how much your copay is in order to pick up that prescription that day. And the cultural attitude between the UK and US is different too. In the UK, people hesitate to even use antibiotics because everyone's been trained to fear superbugs. Like, I legitimately think they think paracetamol is the answer to everything, but in the US, you sneeze once and there's a pill, spray, vitamin gummy, something waiting for you. So if you're more into the natural approach, you'll probably prefer the UK way, whereas the US will lean a lot more into Western medicine. And again, just like the appointment section, you won't have anything come out of your pocket in the UK, most likely when you're picking up prescription, or it'll be very, very minimal. But in the US, you will have a copay. Next, let's talk about emergency room visits. In the UK, it's called accident and emergency, or A&E for short. You show up with a broken arm, your friend shows up with a kebab stick lodged in their ear, and you both will wait in the same queue, and you'll definitely wait hours and hours, maybe even overnight. But again, there is no fee that comes out of your pocket once you're seen by the doctor. I hope you're seeing the theme here. The UK makes you wait forever, but you don't have to pay anything out of your pocket, whereas in the US, the emergency room visits get you seen almost instantly, but it will cost you a lot. And this goes hand in hand with the next section of waiting times, which honestly I've touched on this in multiple points, but it's worth going over in a little bit more detail. In the UK, waiting for healthcare is practically a national pastime. It's like cricket. Nobody really understands why it takes so long, but you sit there and you politely suffer. You tell your GP about your chest pains and they say, right, we'll see you in 6 months. If you're still alive by then, we'll take a look. And in the US, waiting times are a lot shorter, but not always painless. You might have a quick appointment, you know, you call and you get an appointment that day, but then you might sit in the waiting room for an hour or so waiting for your appointment, filling out forms with all of your insurance info. And then once you're in the doctor's office, you might have to, you know, wait in the room for 20 minutes or so for them to actually come in and see you. So again, the UK is slow, but it's free. You'll wait for hours and hours in the emergency room, or you'll wait weeks or months for an appointment or a referral, but you don't have to worry about a bill. In the US, you can easily get same-day appointments for pretty much anything you have wrong with you. And yeah, you might still wait in the waiting room just a little bit, but you'll get seen that day. But you will need to pay before you're seen, or you will get a bill in the mail afterwards. That might be super expensive. So again, pros and cons. What do you value more, time or money? And now let's talk about that biggest difference, the cost. This is where the cultures really split. In the UK, healthcare is free at the point of use, like I've said multiple times. This means, yes, of course, you pay for healthcare through your taxes. Nothing is ever free, even though it's advertised as free healthcare, but you will never pay for anything out of your pocket. When you go to an appointment, you take a trip to the A&E, you pick up a prescription, you have a baby, you get surgery, you take an ambulance ride, and pretty much anything else that's medically related. So if you are someone who sees the doctor a lot, or you have a condition where you're constantly using health services, getting prescriptions, doing that kind of thing, this is an amazing deal. And honestly, even if you don't really use it, it's nice to just have that peace of mind that you can always just go and get anything checked out, even if it's only slightly bothering you, and you won't have to worry about the cost. And of course, we all know that in the US, it is the complete opposite. In the US, health insurance works a bit like an expensive club membership. You pay a monthly fee called a premium just to stay in, but that doesn't mean everything is free when you need care. Each time you see a doctor, you typically always have have to pay a small set fee called a copay, and before insurance actually starts kicking in and helping you with those big bills, you usually have to cover a certain amount of your own medical costs called a deductible, which can be thousands of dollars per year. And once you've met your deductible, your insurance will start to pay more. Sometimes everything after that deductible, and sometimes just a large portion, but even then you will still receive bills in the mail for services like x-rays, lab tests, ambulance rides, or even having a baby. So in short, you pay to keep the insurance, you pay when you use it, and you might keep paying until the system finally kicks in to cover the bulk of your expenses. But exactly how much you pay is determined by what kind of insurance you have. So this is why it's super important to not only look at the salary when you're accepting a job offer in the US, but look at their benefits package of what kind of insurance they're offering. I've been super lucky to have really amazing jobs in the past where my monthly insurance cost was only about $50, and my copays for going to the doctor have been about $20 to $30-ish per visit. So that's not horrible in my opinion, but if you don't have great insurance, you could be paying hundreds of dollars a month just for the insurance, and then $50+ for copays for every single visit, and a super high deductible of over like $10,000 a year you need to spend before your insurance kicks in and starts covering expenses. So as an American who has dealt with the US healthcare system my whole life and now has dealt with the UK healthcare system the past 2 years, what's my opinion on which system I prefer? Like I said multiple times, you just have to decide what's more important to you, time or money. Part of the reason why I chose to have my baby in the UK was solely the cost. I thought it was so amazing that I wouldn't have to pay anything out of my pocket to have my baby, and that was just so important to my husband and I, to just save us the stress of hospital bills and just figuring out how we're going to afford it rather than just being excited for our baby. However, after going through the traumatic experience I had with my complicated birth, all of the complications I also had postpartum for the care both for me and my daughter, waiting so long for appointments for some pretty serious things, I can truly say that no amount of money is worth some of the bad care or the crazy long wait times that we got. And I'm not saying that the entire NHS system will give you bad care. I had amazing doctors and midwives throughout my maternity experience, but I'm just saying that I did have some bad experiences and I thought that I valued money more. And then after I experienced the NHS, I realized that I would have much rather paid and gotten better care and less wait times than what I experienced. So everyone will have a different opinion based on their own experiences and care they've gotten. So let me know in the comments which system you prefer if you've experienced both. Now let's take a look at why I decided to move to the UK in the first place.